And cuts in the Christie budget to Planned Parenthood in New Jersey could wind up costing the state more in the long run. That's the word from advocates who specialize in women's health. As State House correspondent Zachary Fink reports, the cancellation of a federal waiver application could broaden the scope of the problem.
Like many organizations that rely on state funding, Planned Parenthood took a hit in Christie's budget. However, this cut amounts to a complete elimination of state funds, roughly $7.5 million.
This has never happened before. We've had this budget line since the early 1970s through both Democrat and Republican administration. It's completely unprecedented that they would eliminate funding altogether.
Planned Parenthood provides reproductive care and other services to roughly 136,000 New Jerseyans, mostly women, each year. There are 59 centers throughout the state providing prenatal care, including gynecological and breast examinations. But it's not just the loss of state funds that will potentially lead to 40,000 fewer women being treated next year. The state had been working with the previous governor's office to get a waiver from the federal government, allowing Medicaid expenses to be reimbursed. Planned Parenthood New Jersey has been informed by the Christie administration that that waiver application is being withdrawn.
What it would have allowed us to do was take $1 million from our state funding line to leverage $9 million in federal funding. It would have allowed us to expand to 66,000 new patients. And once we learned that our funding had eliminated, it would have allowed us to transfer some of those patients into this waiver program.
Planned Parenthood often uses the 4-to-1 formula. In other words, for every dollar the state spends, they save $4 by providing family planning services, including counseling that prevents unintended pregnancies.
Without the funding, more of those pregnancies will come to term, which will stretch the Medicaid rolls and put an additional strain on charity care. Advocates say it will result in a net loss to the state in terms of actual dollars. Since Planned Parenthood also provides abortion services, some have questioned whether the cut was ideological in nature, since Governor Christie is pro-life. In a statement, Christie spokesman Mike Juniak said, quote, "Budget cuts were made across the board. Very few programs or government functions were spared in our efforts to close a nearly $11 billion budget deficit. Unfortunately, this is simply the fiscal reality we had to confront." Zachary Fink, NJN News, Trenton.